Hi. Afternoon. Thank you for coming. For those that don't know me, I'm Nicolson. I'm a clinical lecturer, specialty registrar in haematology in Birmingham. I'm the current chair of the HaemSTAR network. I would say I'm very, very grateful for you all for signing in to this research outcomes meeting in the middle of this second wave. And I appreciate that what we didn't anticipate was that it's registrar changeover day. It's clearly for some deaneries, and clearly that's very poorly planned. But so thank you for turning up and coming and watching. I'm going to be introducing HaemSTAR to you and introducing a bit about what the meeting's about. I want to keep my introduction of HaemSTAR quite short because most of you have probably heard me introduce HaemSTAR before, and I want to allow maximum time for project leads to speak. But for those of you here uninitiated, I want to briefly talk about why HaemSTAR was conceived and what it is. And I then want to talk you through our current sort of portfolio of projects and what we've done. And then main driving forces behind creation of HaemSTAR were sort of three things. Firstly is promotion of non-malignant haematology. Secondly, promotion of research in district general hospitals in addition to teaching hospitals, and thirdly to help train registrars in PI skills that will allow them to do research in their hospitals in the future. There's a lot of current research mainly in malignant haematology, and actually similarly in malignant haematology, in non-malignant haematology in terms of numbers, but most of that is in haemophilia and also in anemia as it relates to other disease areas such as renal failure. And there's actually very little active research in other areas of non-malignant haematology. You say when you compare that to malignant haematology, its difference is really stark. It's likely to be because malignant haematology is quite emotive. There's much more drug company interest. There are many more and more successful charities that fund research in malignant haematology. So we feel the reason for this being set up is that non-malignant haematology research needs promotion. Secondly, there's geographical discrepancy in patient access to research across the UK. This heat map of England shows here, this is from 2019, you've got where the number of studies is represented by the size of the circle, and how dark the circle is represents how many patients are being recruited per study across all medical disciplines. And it basically shows that patients who live near tertiary teaching hospitals have more access to research studies. And actually, the department's engagement with research has shown to positively correlate with research outcomes. And also in general, in a hospital, the engagement of research has been shown to improve standard hospitalized mortality ratios across the whole hospital, and also improve better CQC ratings. So the more your hospital engages with research, that correlates with better patient outcomes. And thirdly, one thing we want to address is that the current registrar training program trained us very well to be medical consultants, and it trains a minority of us well to be chief investigators, so that people go out of program, do PhDs, and end up being senior, have an academic post and time. But most of us will have a full-time NHS post, and to engage in research in that capacity, we're not trained for at all. That's the principal investigator role. And they say we have no training to do that as a registrar. So HaemSTAR was set up to try and increase participation in non-malignant haematology research, particularly to do that in district general hospitals, and to do this primarily by involving registrars. We set up in 2017. We've grown our network such that we now have representation in every single NHS deanery in the UK. We have a centralised committee who lead on strategy and overall direction, and that information is then disseminated to regional leads, who then involve all appropriate local registrars for any given individual project. And it's beneficial to all involved because it's flexible. People can do as much or as little as they can, and they will at least be acknowledged and given PubMed citable collaborator status on any publication that comes out of the work that they've contributed to. Involvement with research is on the registrar curriculum, so that ticks this box. There's no need to actually think and generate lots of study ideas, no need to spend a lot of time analysing data, just collect it. And in doing so, you will gain PI training by doing the PI roles of a study in the local hospital, but in a way that's supported by your local consultants and also by us, HaemSTAR centrally. initially, we wanted to try and make an impact in a single, sort of make a splash. So we picked a single disease area, that of ITP, and our roadmap was to support a small observational study. So that was the TRAIT study, looking into real-world outcomes of TPO-mimetics for ITP, annoyingly still unpublished. A registry study, so the ITP registry, that project is still ongoing, something we are helping with but haven't actively led on. And then a larger phase 3 trial, the FLIGHT trial, which is the only first-line RCT in ITP to be performed for several decades. And then to actually finally develop and lead on our own project. So this is where the flash mob audit initially in IVIG use in ITP was done in 2018. But we're not specifically an ITP network. And so we branched out into other areas of non-malignant hematology. So those being TTP, where we have developed our second flash mob project, which you'll hear about later. Transfusion, with the ARIA study into looking at inappropriate or appropriate use of red cell transfusions in acute medicine. And then in VTE with the MASCOT study looking at splanchnic vein thrombosis and its outcomes in patients with myeloproliferative disease. The CAVEAT study looking at how we manage VTE in the setting of thrombocytopenia, and then developing further projects. So our own lead study, the sort of the third flash mob that you will hear about later. And then because it's topical COVID, we're going to hear very soon about the retrospective observational study in COVID coagulation abnormalities in COVID-19, and then also how we've contributed to the sort of the REMAP CAP study. None of these have actually published yet, which is a bit frustrating, but I think you will see from the data that we're going to generate from today, and that all these ones that are now highlighted in blue, that actually there is practice changing data that will be published soon. You will be acknowledged soon. So it's going to be, I think 2021 is going to be a big year for us and for the projects that we've supported. Anyway, so without further ado, I think that's all I really wanted to say. I want to leave as much time as possible for the talks and for discussion.